Well, today is the day the Advisory Committee on Immunization Practices has been meeting for hours to discuss big changes to routine childhood vaccinations. Their first big votes just happened. Tomorrow is COVID, but WRAL's Grace Haba joining us now. Grace, you've been monitoring the meeting all day to see how this could affect access to vaccines and costs for millions of families.
Yeah, that's right, Ashley. Now, the scene that you're looking at right now may not look all that exciting or like much is going on, but the decisions being made in this Atlanta boardroom today are affecting millions of Americans. Today, the ACIP is voting to change the guidelines for both the MMRV and hepatitis B vaccines. MMRV is the vaccine that protects against measles, mumps, rubella, and chickenpox. This evening, the board voted to remove the CDC recommendations for the vaccine for kids under 4, citing claims that it puts young children at a greater risk of what are called febrile seizures. Now, children still do have the ability to be vaccinated with the MMR vaccine by itself and then receive the chickenpox vaccine separately. A larger topic of debate today was also the hepatitis B vaccine, and for decades that has been given to newborns right away at birth. But right now, as we're doing this report, the board is voting on whether to delay that vaccination until the child is 1 month old or potentially even longer. Without these CDC recommendations, many insurers, including Medicaid, will not cover the previous vaccinations. And that means parents who still want their kids, for example, to get that 4-in-1 MMRV vaccine could be forced to pay hundreds of dollars out of pocket. Several health institutions today using the public comment section of this meeting to object to what the board is deciding to do. But one UNC physician says anything said today was unlikely to change these board members' minds.
I am worried about stripping things like hepatitis B vaccine and whittling away at the real important safety net that we've created to eliminate really problematic infections or minimize them and not see a recurrence or emergence like measles and whooping cough. Whooping cough is huge right now in many parts of the country. They're dealing with this. And that's in North Carolina, we're dealing with this in the western part of the state as well. This is preventable.
And some say it could take over a decade to see how an hepatitis B vaccination decision could affect these children. As you mentioned, Ashley, tomorrow the discussion is going to shift to COVID-19 shots and who's going to be able to get those this fall. We, of course, are going to monitor that and bring updates as they unfold.
Big impacts here, Grace. Thank you.